Are you still experiencing a significant amount of pain in your lower back following spinal surgery that was over 3 months ago? Well, that can be incredibly frustrating, and you may have a syndrome called failed back surgery syndrome. My name's Anthony Ghosh. I'm a consultant spinal neurosurgeon and founder of the Spine MDT, and in this video I'm going to explain what failed back surgery syndrome is and what we can do to help. The term failed back surgery syndrome doesn't necessarily mean your surgeon did anything wrong. It's simply a label we use to describe pain that persists despite spine surgery. Sometimes that pain is different to the pre-surgical pain you had. Sometimes it can be the same or even worse. It's not necessarily about failure, but simply demonstrates the complex nature of pain. Let's have a look at some of the mechanisms. Well, sometimes it can be caused by scar tissue, what we call fibrosis, stuck to the nerve roots and therefore not allowing the nerves to move freely. Or sometimes it can be adjacent segment disease. So a single level of the spine here is fused, therefore the adjacent level has to move excessively to make up for that loss of movement, and you start to develop wear and tear. Their residual pathology, i.e. has enough disc been taken away to free up the nerves, or has the correct pain generator even been identified? If decompression of nerves has taken place in the surgery, has any instability or imbalance of the spine also been addressed? And finally, nerve sensitization. Despite everything looking fixed on the scan, you're still in pain. So even though the pathology may have gone away, as we mentioned, pain is rather complex with lots of other factors that are potent amplifiers of pain. Have these issues been addressed? The first thing I do is take a very detailed history, going through what your symptoms were before the surgery and see what exactly has changed afterwards. Then I examine you to look at your overall neurological function, where any tender points might be, but also look at your general functional movement. I then request various tests and then compare your scans before and after the surgery. I look for any problems with the hardware, if any metalwork was placed, or if there are any signs of infection. I then look for false guarding or false protective behaviours. Are you moving in a way because you believe that may be helping you, but are you actually reinforcing the pain in doing so? And then we figure out ways of how to correct this with a good physiotherapy team. I believe in a team-based approach so that I can try and identify non-surgical ways of resolving the issue. So targeted physiotherapy or osteopathy. Are there any injections or targets that I can inject with a steroid, for example, to break the pain cycle, whilst the physiotherapist also works with you with specific exercises? Sometimes a pain specialist I work with may consider spinal cord stimulation, where a special device is implanted to try and distract the brain from any pain when there isn't a true pathological cause of pain. But sometimes revision surgery is considered, and again I like to discuss this with my team to ensure that nothing else can be done. However, if there is missed instability or failure of the instrumentation, then often sometimes surgery is the best answer and will actually achieve good results in the end. So if you still have persistent pain despite surgery some time ago, don't lose hope. We can usually find a solution. It's about looking at the bigger picture and not just the scan. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel, and please check out the other videos for useful tips. Also visit us at spinemdt.com to see how we can help you. Thank you very much for watching.